Most people know somebody, a friend, a family member, a work colleague, somebody that they're close to who's either died or had problems with a substance use disorder.
Unfortunately, New Mexico has a worse addiction problem than most of the country.
In New Mexico, we're having over 1,000 deaths a year.
That's overdose deaths across the board with all medications. But opioids make up the overwhelming majority at over 70%. That's why the New Mexico Poison and Drug Information Center at UNM Health is using its resources to directly target substance use disorders.
We have 45 years of experience here at the Poison Center dealing with poisoning emergencies. Our staff is among the highest performing of any poison center in the country.
As a new service for New Mexicans, the Poison Help Hotline is now offering assistance, providing resources for drug and alcohol addictions.
We can help them with answering their drug addiction questions. If medications are appropriate for you, we'll work with your primary doctor so that you can get access to some of those medications.
They can also send fentanyl test strips, naloxone, or Narcan through the mail.
I also think that it's important to be available to help New Mexicans on their terms and on their timeline, because there's a moment where people are ready for help and we don't always know when that is. And you really hate to see somebody who's interested in help today, but because they have to make an appointment, waiting 3 weeks, I want to try to minimize some of that time frame. And then for our folks in rural New Mexico, that often means that they're going to have to travel to a larger city or further out, and resources are further limited, and that's just not reasonable. So we want to try to help them in their communities as well.